You're watching the latest edition of the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, the end of back pain, neck pain, shoulder pain, knee pain. And we're talking about stem cells today and some of the newer uses of stem cells. And with us, we have an expert on the topic. He is Austin's go-to pain management physician. He calls it regenerative medicine. With us, we have Dr. Mihnea Dumitrescu. Dr. D, welcome to the program.
Thank you, Randy, and thank you and your staff for putting this together for me.
Now, your patients call you Dr. D. That's why I called you that.
That's correct. My name has too many syllables. You've already done very well by pronouncing it once. So.
Now, for people that don't know your center in Austin, Texas, like who's the typical pain patient you see, and who's the typical stem cell patient you see?
The typical patient that we see for pain falls into two categories. There are the people who come in for back pain, and that could be neck pain, thoracic pain, and lumbar pain. And then we have the people with peripheral joint pain or musculoskeletal problems, let's say shoulder, elbows, wrists and hands, hips, knees, ankle and foot pain. Now, of those people, a lot of them actually come in for stem cells. And the typical patient that comes to us for stem cells might be, well, let's say the weekend warrior who, just now has back pain or shoulder pain or neck pain, and he's absolutely terrified of having surgery.
Okay.
And he doesn't want to be on opioids, or we get referrals from neurosurgeons or spine surgeons who have no idea what's going on with their patients and what to do to them. And we help the patients and the surgeons understand what the problem is, and if we can, and if it's appropriate, we offer people regenerative treatments.
Okay. Now, and correct me if I'm wrong, most pain management physicians come from anesthesia. You have different training as a physiatrist.
Right.
So what is that training? How does it differ?
Well, I would say that in the field of pain management, anesthesiology and PMNR, physical medicine and rehabilitation, which has entirely too many syllables, so we'll call it PMNR,
okay,
are about equally represented. And the difference is that maybe PMNR physicians like myself have more training in neurological disorders, and PMNR is a specialty that is directed at regaining function. So you regain function after an injury, you regain function after a brain injury, stroke.
Okay.
So it's a specialty that got started after World War II veterans came back from the war after World War II, and they needed rehabilitation across a spectrum of medical specialties.
Okay.
So PMNR field was born, and obviously it incorporates neurology, neurosurgery, interventional orthopedics, rheumatology, maybe even pediatrics. So our training is a little different. We don't really give people a lot of medication or anesthetics, right? But we look at the function of the patient in a more holistic context.
Now, we were talking, on the phone in a pre-production meeting, and you were saying that, I'm paraphrasing a lot here, but that you didn't want to be the opioid guy. And that's what it was like in most pain management settings.
Absolutely.
Can you elaborate on that?
Yes, absolutely. So when I started my practice in 2007, I had attained probably the highest level of training that a physician can do, which is called fellowship training. I was really at the right place at the right time, and I benefited from training with a incredible physician by the name of Charles April in New Orleans. And I came to Austin and I opened my practice, and it was, let's say, your classic pain management practice. Yeah, we treated people with some opioids, and we did epidural injections, and we did nerve blocks, and we did ablations, discograms, spinal cord stimulators, and the like. And I personally had an injury, a ski injury on my knee. And I managed to get over that injury and treat my knee pain with regenerative treatments. And
what does that mean, regenerative treatments?
Regenerative treatments means that you're using your own body's ability to heal. So you're using substances from your own body, either from your blood, from your bone marrow, or from your fat, in order to affect the healing process. So it's a natural biologic healing process as opposed to the pharmacologic or ablative, destructive, or cortisone.
So stem cells falls under that category?
Absolutely.
So you injected your knee with stem cells?
So I inject my knee with PRP, actually, which is platelet-rich plasma. We're probably going to talk about that in a little while. And I had 4 sessions of PRP, and I went to the same physicians, the same orthopedic surgeons who told me that I needed surgery. I had before and after scans, and they couldn't believe it. They said, "Oh my God, what did you do to your knee? We're sorry, we don't have to operate on you anymore." And that sort of, I had a switch in my mind immediately, and I totally changed my practice after that.
Really?
Absolutely. So I gave up the pain management part, or the classic pain management part. I use it in context of what I do, but then I focused on regenerative and functional medicine. And then, I never looked back, and it paid off big time, because not only I see people that are healed right now, and I managed to heal people, but I managed to educate people and have them avoid injury further, right? So then this is probably the biggest satisfaction in my professional career.
So it changed everything.
It changed absolutely everything.
Is this true? Because I've talked to medical doctors. We've had the show for 25 years. They will treat their spouses, their best friends, their family members with stem cells, but they don't offer it to the patients. Look, is there truth to that?
Absolutely. Look, I have a number of patients who are doctors or doctor spouses, right? And they don't use stem cells. They don't talk about stem cells. When it comes to themselves and their family, they all come to me to have these treatments, right? So this is, I think,
why is it that way?
Well, because it's not paid by insurance, right? So most people choose to do things sort of the traditional way under insurance. And it's also very tedious, right? You need a particular type of training, and you have to have a particular type of personality to go through the steps that are required for regenerative medicine to work and be successful. So, there's
and
a
I
lot
know
of
I know
entry.
your prices, by the way. I mean, it was shockingly low, by the way. I mean, I know we're in San Diego here, our newsroom.
Right.
People are going to Mexico, they're going to Cancun, they're going to the Cayman Islands.
Yeah.
And you are about 70% less than those prices.
Well, I try to keep this regenerative treatments accessible, because I don't really think that they need to be just for professional athletes anymore. Because, by the way, this all started with professional athletes.
Is that right?
10 years ago, everybody was talking about Peyton Manning and Kobe Bryant and Rafael Nadal getting these treatments, right? And I was talking to their doctors, and it was a big thing, right? But right now, everybody can have access to it.
So athletes that are in the know, right? They have to be out there the next week.
Yeah.
Most of them are doing this.
Look, Austin is, for some reason, a city where a lot of athletes and NFL players train off season, right?
Okay.
So I see quite a number of these people, and really the first line of treatment, or the go-to treatment for these guys, are usually stem cells. I think every professional team now, probably uses stem cells as a first line of treatment.
Is stem cells a loosely defined word? Because you help me understand. PRP is not stem cells.
PRP is not stem cells. So in general terms, if you talk about stem cells, there are two categories, right?
Okay.
You have the autologous stem cells, which means that they are derived from your own body. And the stem cells that we use are generally derived from bone marrow or fat, right?
Okay.
There are other stem cells in the body that we don't use, but that's what we use. And then you have the allogeneic stem cells, which are derived from somebody else's body, right? So these are the birth tissues, right? So stem cells derived from placenta or umbilical cord or other birth tissues, which are normally discarded
They work
at
well?
birth. Those have the highest regenerative potential, but they also come with the highest regulatory hurdles, as you can imagine. So you mentioned PRP, right? So PRP is actually not exactly stem cells.
Okay.
And I know that there's a misconception about this, many people.
For people watching this, PRP, they draw your blood, they spin it.
Exactly. So PRP stands for platelet-rich plasma. The platelets are cells in the blood, and what they do, generally speaking, is make blood clots. Now, for the cells to make blood clots, they are filled with growth factors, as you can imagine. Okay. So what we do is a simple blood draw, is a painless blood draw. We collect the blood, and then we spin it in a centrifuge, and we're able to isolate and select the platelets. So we make a concentrate of platelets called platelet-rich plasma, and we inject this concentrate into the affected tissues. Right?
Okay.
Now, there's a difference between PRP and stem cells, right? So the difference is that the number and the types of growth factors in PRP are not as rich or as diverse as the numbers and growth factors in stem cells. And also, when you inject the PRP in a tissue, the cells break down immediately, so they don't last as long as the stem cells. The stem cells break down too and release their growth factors, but they do it over a longer period of time. So this gives stem cells a higher regenerative capacity, a higher regenerative potential than PRP. So PRP are not really exactly stem cell light, but they do work.
So you do a lot of PRP.
We do PRP every week, because look, everybody gets from point A to point B, right?
Okay.
But you don't necessarily need the Rolls Royce to get from point A to point B, right? Sometimes a Toyota is just fine. And I'm not saying in a derogatory way that PRP is a Toyota, but for, let's say, mild superficial injuries, let's say a tennis elbow, right? Or elbow tendonitis, or maybe plantar fasciitis or heel pain. So for those types of injuries, PRP works great.
And shoulders or no?
Shoulders to rotator cuff injuries, as long as the rotator cuffs are not completely torn. And I have actually a story about a rotator cuff in a little while, but I want to tell you about plantar fasciitis. Just probably a couple of months ago, I had this patient who's 45 years old.
Okay.
He comes in with heel pain. He has had heel pain for 8 months, right? And he's completely despondent. This is a gentleman who likes to work out. He likes to be active. He likes to run, actually. He cannot run. He sees his primary care physicians. He sees a podiatrist. He's being told, you need shoe inserts. And he tells me he spent $5,000. He likes sneakers too, right?
Okay,
So he spends $5,000 buying all these sneakers, all the inserts. He cannot do anything. He cannot walk for longer than half a mile. He definitely cannot run. He puts on 15 pounds and now he's depressed and all this. I talk to him about it. I evaluate him. We get an MRI. We confirm that this is the diagnosis. He had 2 shots of PRP in his plantar fascia, directed with ultrasound and X-ray guidance. He's already walking. He's already starting to jog. It's 3 months later, right? So PRP has definitely a role, and it works great in these superficial and things that are not very, let's say, more musculoskeletal and more peripheral. Now, spine is a little bit different, right?
More complicated?
A lot more complicated. And
we're talking about low back pain.
Low back, but also neck, right?
Okay.
And we can talk a little bit about neck. But low back pain, spine pain in general is more complicated because spine is a little different because spine is a very complex system, right? So there's a front column, a back column, there's nerves, there's joints, there's discs, right? So PRP, in my hands anyway, was not working as well for spine as it was working for shoulders and knees and other things. So with spine, I use stem cells, and not only stem cells, but just like I do with everything else, this is a very complex regenerative plan of treatment where we not only use the injections themselves, but we do a lot of prep work ahead of time and then a lot of follow-up afterwards. We use peptides, we use supplements, we use different strategies to increase the stem cell content in the body, such as hyperbaric chamber treatments, fasting, and other things. So with spine is more complicated. Just leave it at that.
Well, now what about the disc? I mean, can you inject stem cells into the disc? Don't you have to do it around the surrounding areas?
I'm so glad that you asked this because injecting disc requires a level of expertise that is higher than most people attain, during their training. Even people who have training, right? Even people who have fellowship training. And when you're talking about cervical discs or neck discs, for instance, right? In the cervical spine, everything is really tiny and shoved together, right? So you have discs, you have joints, you have nerves, you have arteries, right? So it is always amazed me that most of my colleagues even stay away from neck pain. I mean, if you have neck pain, well, you're out of luck because nobody is going to do regenerative treatments in the neck. So if your disc hurts, I don't think that you need to be a fellowship trained pain interventionist to realize that you have to inject the structure that hurts, right? Okay. So if your pain is coming from an injury to the disc, you have to inject the stem cells into the disc, right? You cannot just say, again, for the reasons that we just talked about, that injecting around the disc, somehow these cells are going to find their way inside.
Again, it is MRI, fluoroscopy, X-ray.
Right. So we
guided to the disc area.
Into the disc or into the joint or into the nerve or into the ligaments, everything that we've determined previously are sources of pain.
Have you ever had patients where their pain goes away because you put stem cells in the disc?
All the time. All the time. I have patients all the time, like I said, who come to me and said, oh, I've had stem cells, doesn't work. I had PRP, it doesn't work. And then I look at what was done and we do it a little differently. We get to the source of pain and then they get better, right? And not just with that. I mean, to be fair, yes, we get to the source of pain, but this is contextual, right? We have physical therapy, we have a different part of our clinic that's more of a concierge part of the clinic where we help people lose weight and we help people get, healthier and understand how to optimize their health. So we're trying, again, because of the PM&R background ties into this, we're trying to be more holistic in our approach and restore function.
Now, fusions, right? We talked over there. And have you ever had, I think you said you've had patients that were scheduled for a fusion.
Yeah, absolutely.
And because of stem cell or some of these regenerative techniques, they were able to avoid fusion.
Right.
Is that true?
It's true. And look,
a lot? That happens a lot?
That happens a lot. Fusions work great when people have some sort of a spinal instability, right? Or they have some sort of spinal deformity, or fractures of the spine and things like that. Fusions for a chronic degenerative condition, like arthritis of the back or wear and tear in the disc, doesn't work as well. And this is where these regenerative treatments have a huge role in avoiding these fusion surgeries. Again, you have to catch these people, early, and you have to, actually talk to them. You have to show them hundreds of MRI slices, and then you have to explain everything to them, and then actually do it well.
I've had more than one doctor, a spine surgeon comes to mind, that said there's about 300,000 to 600,000 fusions being done a year. I'm going to ask your opinion on this, put you on the spot. In your opinion, how many of those do you think could have been handled differently and avoided?
I mean, I think a conservative estimate would be probably half. We could be less conservative and say maybe 70 or 80% of them. Look, fusing somebody's back is a medieval technique, right?
Really?
It's not. It's like an Iron Maiden, right? You're basically taking you're taking motion away from one or more spinal segments, right? How is that possibly going to work long term, right? I mean,
do they work long term?
Well, that's the thing, because depending on some people 1 year later, some people 5 years later, what happens is because you're fusing segments in place, above the fusion and below the fusion, there's going to be more motion, and more motion is going to create more degeneration. So now you're going to be faced with what surgeons call adjacent segment disease, right? So
it's kind of a patchwork, temporary patchwork in a way? I don't want to put words in your mouth, but is it?
Well, it is, absolutely. And then, now I don't want to say that nobody does well with fusions. I'm definitely not making that statement, but what I want to say is that everybody should be sent to a doctor like I am to try different things before they decide to have fusion.
Are you called an interventional pain management physician, physiatrist?
Well, physiatrist is the term for a PM&R physician, but nobody uses it. We're called pain physicians probably, which is a little bit of a misnomer, because I started all this, so I am not the opioid guy, right? I mean, these people who come to me terrified they're going to be on opioids all their life.
Opioids, for many people, they work. They get them out of pain. Have you had people that you've taken off of opioids with these regenerative techniques?
Not taken off the opioids or never started on opioids, which is even better, right?
Can you take me through the process? And maybe we'll start from the top down, like neck, cervical.
Absolutely.
Which I've been told you got to be careful with stem cells in cervical, in the neck.
Right.
What's the process? They go to your practice. What happens? Take me through those steps.
People come in and they have an initial appointment, and we spend about 60 to 90 minutes on these initial appointments. And there's a history, and then there's talk about their health and talk about all the other treatments that they had, because most people have had a number of other treatments. And then we sit and look through hundreds of MRI slices, and I tell them what they mean, because people come in and they're terrified. They read their MRI reports.
You say they come in with their scans and they're scared.
Absolutely, because everybody reads their reports before they get to me, and they're absolutely terrified that they're 1 foot in the grave. So I spend a lot of time explaining to them what those words mean, and then it's not the end of the world, and that might mean nothing, right? So then there's a thorough physical examination that's tailored to what we're going to do therapeutically, right? So obviously, if they have a neck issues, we focus on the neck. After that, we may talk to them about some diagnostics that we have to do. So, so you have neck pain. Okay, my neck hurts. How do I know where your neck is hurting, right? So I have to do some diagnostic blocks to figure out where your off switches are.
Are you looking at the nerves?
Are you looking at nerves? Absolutely.
The anatomy,
nerves,
what?
Joints, discs, ligaments, everything. So it has to be done stepwise approach, and the people have to fill out these pain journals immediately after the procedure where we determine exactly where the pain is coming from. Once we've done this and we've established that they're a good candidate, so this is all this stuff just to see if they're a good candidate for stem cells, right? So, and a lot of people don't do any of this, right? So now they're a good candidate for stem cells. Now I sit down and I personally write a customized plan of treatment for each one of these patients.
All right.
And that involves peptides, that involves supplements, that involves hyperbarics, fasting, you name it, right? Physical therapy, we have in-house physical therapy, and we get a baseline and they go through physical therapy, and then we do the injections. After the injections, they continue the physical therapy. We teach them how to avoid further injury, and we see them at 1 month, 3 months, 6 months, 12 months. We have objective questionnaires every time, so we don't want to fool ourselves.
This is not how it's always done?
I wish. No, this is not how it's always done. This is a very tedious approach, as you can tell, right? And a lot of people don't take the time to do it this way. And it's a source of frustration for me, because if done right, this field could just be booming, right? And you know, we wouldn't have maybe some of the pushback that we have from the Federal, Drug Administration and other entities, because there are, people who are probably not doing this.
Now we're short on time. We probably have 2 minutes left, but you get stem cells from bone marrow, from fat cells,
yes,
and from kits that you buy.
No, we don't use kits, right? Yes, and the stem cells from your own body are going to be most of the time bone marrow, some of the times fat cells.
And you do it right there. You have an operating room or something.
We have a little lab in our office where we isolate and select these cells and get them ready for injection. You mentioned kits. I just want to briefly talk about kits.
Because this is how it's typically done, right?
Everybody starts with kits. Why? Because it's easy, right?
It means you're buying this kit of stem cells from a manufacturer.
No, you're buying the kit, which is a plastic box with different device in it, and the manufacturer gives you a centrifuge for free, and then you extract the bone marrow and you put it in their kit, and they spin it for you, and the rep hands you a syringe filled with stem cells or PRP. The problem with that is that you have no idea what's in that syringe, right? So if you're curious, and you're starting to ask yourself what's in the syringe, and you start analyzing that like we did, you realize that what's in that syringe is not what they tell you.
You did your own lab testing.
Absolutely. So then when I said, okay, I need to have my own lab. Right, and I was lucky to have a couple of friends.
To make sure there's a high concentration of stem cells.
High concentration,
and you're alive.
Absolutely. The viability of the cells, the types of cells, the concentration of cells, and to this day we do a deep dive. We actually do. I send these cells to a university in town, and I have friends who are actually looking at these cells, the numbers, the types. It is unbelievable how many types of cells and how many populations of cells we have in bone marrow. As a matter of fact, we've studied these very small embryonic-like stem cells that are found in our blood and bone marrow that could really, if we can isolate them and expand them, that could probably be the fountain of youth.
Is that right?
Absolutely.
Okay, so you got their own bone marrow. Is that a super painful procedure?
I'm glad you asked that, because people don't complain of pain at all. We put people to sleep for these procedures, and the bone marrow extraction.
Like an IV sedation?
IV sedation.
Okay.
Yeah.
Okay.
We have a CRNA in the office, and we do this under sedation. People feel absolutely nothing, and nobody complains of the extraction pain. Very rarely we have somebody saying that maybe their hip is a little sore, but. No, that's not a problem. It's not an issue.
So this is no longer just for the athletes and the high-earning CEO or people with a lot of money. I mean, regular people are getting this done?
Absolutely. I'm sorry, Peyton Manning, but the UPS truck driver can get it now.
We're out of time completely, but misconceptions about stem cells that maybe drive you nuts or frustrate you. What are they?
I think probably the biggest misconception is with people who think it's all a fraud and they don't work. And people come to me and say, well, I use Google ads that didn't work, or Facebook ads that didn't work, and my what we tell these people is that, did you use the right type of ad, right? And it's the same with stem cells. They work, but they have to be done in an appropriate context by
with the imaging, the right concentration.
By a trained physician in the right concentration and delivered with the imaging. Remember the 3 tenets.
So
right?
precision, you got to inject them to the problem area.
Precise diagnostic of a appropriate biologic agent delivered with imaging.
I'm surprised that it's not always being done that way.
Me too.
And I have to take your word for this. I mean, I know a couple guys, like plastic surgeons are doing this, family practice physicians are doing it. And you're saying it's mostly done blindly, putting in PRP, which is not stem cells.
Yeah.
And hoping for the best.
Hoping for the best, right? I mean, look, you're not coming to me if you need a facelift, right? Okay. I'm not a plastic surgeon.
Okay.
I think if you need this kind of therapy, you have to go to a person who's trained to do this.
But do they always end up a little better off because the stem cells, when injected in the right area?
Absolutely. I think most people, especially with peripheral joint issues, have good to great outcomes, right? In the spine, if we apply very strict criteria, right, for the patients that we choose, people can do very well.
Do the stem cells grow cartilage, or does it grow muscle?
No, this is not how the stem cells work. People think that you inject stem cell, in a knee, and the stem cells gets into your knee and says, "Oh, I'm in a knee. I'm just going to turn into a knee cell." But this doesn't work that way.
Oh, is that right? Okay.
The stem cells break up and they release their growth factors and they release their proteins and
and your body repairs itself.
And these actually, lock into the key of it's a lock and key mechanism on the receptor site on your cartilage and tell those cartilage cells to multiply and heal, right? So stem cells should be called signaling cells.
Signaling cells.
They signal the existing cartilage to grow, which is why if you don't have any cartilage, right? If you're a proverbial bone and bone osteoarthritis, the stem cells are not going to make any more cartilage. Now, they're going to work through anti-inflammatory effects, so they're going to ease your suffering, but they're not going to make more cartilage.
Okay, good. At the top of the show, I said the end of back pain. I know that this isn't the end of back pain.
No.
But there are tens of thousands of people, millions in America, in your opinion, you think that are suffering that don't have to be?
Absolutely.
And there are hundreds of thousands of people getting fusions that could be avoided.
Absolutely. There's a lot of needless suffering there.
People taking opioids that don't have to be taking opioids.
Correct.
Wow.
Correct.
Okay, final message. Somebody watching this, they're in pain. Neck pain, shoulder pain, knee pain, whatever. And they've never seen a physiatrist, possibly, interventionalist. What do you say to them? They're skeptical still.
Right. I tell those people, I'm a skeptic. I don't jump at any shiny new object that's put in front of me. And I've arrived at my love for stem cells through a personal journey and also through hundreds and hundreds of people that I've seen healed. I'm very conservative in the way I do things, and we do not promise things that cannot be done.
Okay.
So come in, have an evaluation, and then decide for yourself if what we do is
And those kind of
appropriate for
things
you
are
or not.
covered by insurance, right? For the evaluation, things like that?
Absolutely. The evaluation is a normal appointment, like you would go to any other doctor.
So if somebody wants to make an appointment, do they go to your website or just call your office?
They can call the office or go to the website, find us on social media. We're pretty much available everywhere.
Dr. D, I want to thank you for coming on the show. Great stuff.
Thank you very much.
Appreciate it. You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.